Hi, I'm Dr. Fiorite, and do you suffer from frequent painful tooth and gum abscesses that seem to appear from nowhere even though you practice good oral hygiene? Or have you suffered abscesses on teeth that have had root canal procedures done on them? This malady is more frequent than you realize. In fact, up to 14% of root canals fail and necessitate yet another expensive procedure on the same tooth. That cost could be $1,500 to $2,000 and up to $3,000 to $6,000 if you consider a crown or a bridge. That is discouraging, particularly in light of the fact that you may have felt that your trouble with that tooth has gone and gone for good. Now here's a dirty little secret that not a lot of people know, that you can use your common sense logic and then you can believe this to be true. A dentist friend of mine once told me that most dentists calculate how many crowns or root canal procedures that they need to have per week if they practice endodontics, also that they need to have for a certain yearly income and to pay assistants and dental hygienists. After all, dentistry is a profession just like lawyer or any other paid profession. They have to make money, and they have to do so to survive and grow their practices. The problem is that the procedures could be done shabbily in order to generate further or future income. Thankfully, the majority of dentists are morally upright, but what about the others who do in fact set their patients up for failure and future visits? What of the dentist who recommends a root canal or a procedure that you really don't need, specifically one on a wisdom tooth? Now that actually happened to me, by the way. Or the one who performs a root canal on a fractured tooth. In both cases, the teeth should have been extracted, yet the dentist would maybe make thousands of dollars on the root canal and the post and the crown procedure that comes afterwards versus about $200 on the more prudent extraction. Now, how could a failed root canal cause you problems, you might ask? Well, a root canal is designed to remove the inner pulp of the tooth and extract it to the root, including the nerves, and then disinfect the tooth. Afterwards, the root canal would be filled up with filling material and supposedly the problem is solved, except for when it isn't. If the dentist or endodontist does not completely remove the infected tooth material or disinfect it thoroughly, then bacteria can form a pocket, leading to painful recurring abscesses. What usually happens next is that the dentist will prescribe a heavy regimen of antibiotics, usually amoxicillin. This is where the problems begin. The antibiotic may be a weak initial answer to the problem, but the bacteria that survives will become resistant to the antibiotic until a point arises where the antibiotic is virtually useless. In addition to this, the bacteria forms its own biome in that little space where the abscess is, and the fistula can become nearly untouchable in the center, and the bacteria biome can live indefinitely. To exacerbate the problem, the heavy antibiotics will compromise your immune system and decimate your gut biome, leading to susceptibility to illnesses and, yes, tooth infections. So what's the answer? The answer is strengthening your immune system and gut biome, as well as fighting the infection with botanical agents that will fight the abscess and tooth infections without using the usual antibiotics. The second thing is to use probiotics that contain L. reuteri in any form. Any form will fit the bill. L. reuteri is the most effective probiotic that I have experienced in curtailing overgrown bacteria biomes such as abscesses. Now let's go back to the second part of this. The second treatment would be something like Dr. Christopher's natural antibiotic formula that uses special herbals to fight infections. Hundreds of testimonials on Amazon.com attest to its efficacy in fighting tooth infections. However, be advised that if you're suffering from a life-threatening infection that may necessitate the strongest of antibiotics, don't forego those antibiotics for that regimen. You stick to what your physician has prescribed if you need the stronger ones. This treatment that I'm talking about here is for less severe abscesses or tooth problems. And in my case, this procedure cleared up totally a failed root canal that amoxicillin could not defeat. Try the L-Reuteri and the Dr. Christopher's combination for yourself, and I'm sure that you will be happy with the result. I'm Dr. Fielwright, and I will constantly provide you with delicious recipes to help you eat right and helpful health tips to make you feel right. Thanks for watching, and as usual, have a great day.